It's time now for the award-winning #1 local talk show in Northeast Pennsylvania, The Sam Lesante Show. Now here's your host, Sam Lesante.
Thanks for joining us, folks. Interesting behaviors we have in the world today, and a lot of people looking for information on different areas. What's happening, what's not happening, where are we going? Well, today we were trying to continue giving you an education as to what your health factors. One of the areas that we should be concerned about are our eyes. And who better than turn to but two very professional eye doctors in the area, no strangers to SSP TV with Eye Care Today, but I have doctors Tom Kislan and Dr. James Deom on the phone via Facebook. So, gentlemen, thanks for joining us today.
No problem.
My pleasure.
And Jim is joined by his assistants, and that's...
We got Franklin and Bryn here.
Bryn, okay. I'm sure they gave you all the information, so that we're in good shape. Okay. Let me ask you this, okay? Are your offices open?
So we have closed to routine care as per some of the CDC guidelines and what's kind of been out there, but we are open for our patients. The last thing we wanted to do was leave our patients kind of hanging. So we're open for emergency eye care. We're open for critical care follow-ups. Patients that need us, we're there. We're here 24/7 on call. Dr. Deom takes most of the call in the office. He's gracious to do that, and he's in here almost every day seeing patients. So we're here for our patients, and Jimmy, maybe you can elaborate on kind of what happens when a patient comes in and how we manage things now.
Yeah, so it's a brave new world, and we're trying our best to do a couple things. We're trying to address the need. Certainly, we have a high, percentage of patients that have strong medical issues with their eyes, and that could result in loss of ability to do sort of things they need to do, especially if they are patients that require the ability to go to the hospital and work and see all the potential issues that could be happening with the coronavirus. So we want to make sure that they're able to see and function. So with that being said, we want to give them a safe environment to be seen. And we basically right now are screening the patients over the phone, making sure that they are safe, that they've not been sick, no signs of fever, no signs of cold, cough, or illness, that they've not traveled really at all in the last couple of weeks or months, and that they've not been around anybody that is sick. That's the first step. The second step is if they're able to pass those guidelines, then we are going to go ahead and get them in the office. But to do that, we're going to have them screened at the door and one patient in the office at a time. We are doing, sorry, kids at home. We are doing really strong cleaning guidelines, so we're thoroughly cleaning the office and going from there.
Yeah, I think Sam, let me just jump in there. I think that's an important point Dr. Deom made is, these patients out there still need us, and the last place an eye emergency needs to be is clogging up the urgent care centers and the ERs. A lot of patients in the past sometimes don't even know that they can come to their eye doctor for an emergency eye visit, but obviously they can. We're here 24/7 for our patients, but the last place we want a patient with a piece of metal in their eye or an eye infection is at the ER, where they can get even sicker. So that's the other reason we're here for our patients.
Okay, is this mandatory now by the state, or is this on your own? You doing this by yourselves?
Well, I think that's it's sort of open to interpretation. The CDC recommended that we halt all routine, quote unquote, routine care. So everything from routine and elective eye stuff to knee surgeries, hip surgeries, all that has been put on hold. So we're following those guidelines, and Lehigh Valley in the area has instituted some pretty cool guidelines as far as screening patients, and we're kind of following those same guidelines, like Dr. Deom said. screening patients at the door over the phone, and we're not having a waiting room full of patients. We're trying to do it on an individual basis where we just do it one by one to keep everyone as safe as possible.
Okay, for those people who had appointments with you that have, like, after 3 months or 6 months that are critical, can they call and find out where they stand?
Yeah, absolutely. They can call our office. We have kind of gone down to some limited hours, just because of everything that's going on. So they can call, and if one of our staff is here, our staff will inform them as far as when we can either reschedule their appointment or get them in if they need to be seen. If it's after hours, the call will go to a voicemail, and then we can either get back to them on the next business day, or if it's an emergency situation, we'll get back to them.
So, folks, I'm going to put the phone number up on the screen if it's not already up already for the Hazleton office for eye care specialist. Hazleton Eye Care Specialist is 570-453-2020. For Stroudsburg Eye Care Specialists, the number is 570-421-3342. So please call them if you have any concerns or questions. They're the experts. I know when I was in your office and my wife was in your office in Hazleton here, it's been spick and span. I mean, everything is clean and everyone's taking every precaution which is necessary. What are some of the concerns now that you think we should be carefully looking at? I'll start with you, Dr. Kislan. What do you think some of the concerns now for health of eye care right now, which we should be doing?
I think in general, it's just good hygiene. I don't think we realize how many times a day we touch our face, whether it's to scratch our face or adjust our glasses or anything like that. So I think it's just a lot of hand washing, regular soap and water. I mean, we hear a lot about that on the news. Soap and water works just as good as all these different hand sanitizers out there. So just really good hygiene and keeping your hands away from your face as much as possible. Obviously, the coronavirus, as we know, is an airborne aerosol type virus that does live on other surfaces, but it can be in the air, so our eyes can be exposed to it. So we want to just try to, again, keep that social distancing. So those are just some of the first things that kind of come to our mind. That Jimmy, you can probably expand on that too.
Dr. Deom?
Yeah, so I think what Dr. Kislan just said about our own self is certainly good. We also think that it's great. We also think that there's a potential for it to be passed via aerosol droplets by way of our mouth or mucous membranes, which include our eyes. So, if you think you are going to be in an area where there is the potential for transmission, you'll see some of the healthcare workers out there wearing eye protection. So, certainly clean your glasses, keep your glasses clean, and maybe even wear eye protection or your glasses when and if you're in an area where there are going to be other people. But of course, if you're maintaining the social distancing guidelines, 6 feet, you should be fine from that perspective. With that being said, you mentioned, what kind of issues could there be from an eye perspective. One would be a conjunctivitis. So, this is something that we're going to work with our patients on to try and figure out if this is a conjunctivitis that could be related to coronavirus, or a conjunctivitis that is not related to coronavirus. So what is a conjunctivitis? A conjunctivitis is an inflammation of the white tissue on the front of your eye. It typically turns red, is swollen, may be painful, and is typically watery in nature. So with that being said, if you are experiencing those symptoms, it would be helpful for you to give us a call. We could triage it over the phone and determine whether or not this is something that we could address, or if it would be something that should be seen by a primary care, urgent care, emergency room provider, and may also be a candidate for coronavirus testing. So we can help out in that regard. Now, if you look at some of the early data from the patients who fell very ill early on in this process in Seattle, you'll hear some of those nurses talk about one of the only signs that they saw was that the patients had red eyes. Red eyes, and the skin around their eyes were red. They had no other symptoms. So, again, we're on the front lines of this, even though we're not, an emergency room. We want to really help defray the need for patients to go there, and also help get patients there that could potentially then be self-quarantining and reducing the spread of the condition.
So let me tell you this, viewers, if you are experiencing anything, okay, remember it's only a phone call right now, so don't hesitate to call. And doctors Kislan and Dr. Deom, correct me if I'm wrong, if you have the slightest concern about anything about your eyes or anything that you want to, the phone numbers are on the screen. We're running this show and all the systems, including the Stroudsburg system. Just give them a call, and at that particular point in time, they'll direct you to what to do. Am I correct in saying that, doctors?
Yeah, absolutely.
So now, getting back to the care of the eye, we're going to have that right after we take a break. But remember, folks, Doctors Deom and Dr. Kislan are on every day on three networks. They're on the the Hazleton system, the Scranton system, the Wilkes-Barre system, and on YouTube. So there's a lot of valuable information that they're giving you via their show called Eye Care Today. So if you want to catch up on some of those shows, go to our YouTube or go to our website. Every show is listed there. We'll be back right after this. Welcome back to the Sam Lesante Show, folks. I'm speaking to Doctors Kislan and Deom via Facebook. But before we get to them talking about the eyes and the coronavirus and all the other things we should be concerned about, 24/7, all of our programs on ssptv.com, particularly this show, Sam Lesante Show, with the doctors, but also Eye Care Today. There's a lot of valuable information that Doctors Kislan and Deom give every day on our system. For the Hazleton office, it is 570-453-2020, and for the Stroudsburg Eye Care Specialists, it's 570-421-3342. Dr. Kislan, you were mentioning about some test differentials. What are you referring to?
Before we went to the break, Dr. Deom was talking about conjunctivitis and what it is and all. And, just to back up a little bit and just to give our viewers a little bit of background, when you have a red eye, there's actually three types of conjunctivitis. There's what's called viral, which is our typical quote-unquote pink eye that a lot of people think about. There's bacterial, and then there's allergic. So allergy season, you can get red, itchy eyes. That's one type of conjunctivitis. Bacterial is from bacteria, not a virus, which we can give an antibiotic for. And then there's viral, which usually is caused by something called the adenovirus. And that's the most common type of conjunctivitis we see. And when a lot of patients have a red eye, there's actually a quick test we can do, and I have it right here. It's called the QuickView Adenovirus Conjunctivitis Test, where we can actually, with taking a quick tear sample, tell whether or not a patient has a viral conjunctivitis versus something seasonal, allergic, or bacterial, and that helps guide us in our treatment. Now, this will not differentiate regular viral adenoconjunctivitis versus coronavirus conjunctivitis, but it will help us differentiate the regular adenovirus versus other types of conjunctivitis that are out there. So it's just one of the other tools we have in our toolkit to help us help patients and get them on the way to their best treatment possible.
Precautionary measures are the great things to do so you don't have a problem. But assuming someone is having concern with their eye, it's red or they're rubbing their eye or whatever, what do you suggest they do, Dr. Deom?
I would say first off, give us a call. Call the office any time of day or night, 570-453-2020 in Hazleton and 570-421-3342 in Stroudsburg. Give us a call. Allow us to chat with you on the phone and just see what kind of symptoms you have. That will really allow us to narrow in on what's going on. If we deem necessary, we'll bring you into the office, and we have the ability with really high degree of sensitivity and specificity to determine what type of red eye this is. And like Dr. Kislan said, they really fall into three major baskets: A, viral, B, bacterial, or C, allergic. And so we're able to really kind of hone in on that. And based on those three buckets, we can really help a patient determine whether or not there's other concerns. And this is, in some ways, the Wild West. I mean, we really don't know when there may be a case of coronavirus. So we are exercising extreme caution, and we're trying to be careful, with ourselves, our staff, and limiting the spread. So we're very comfortable doing, telemedicine, calling patients, like this, and there's a lot that you can learn from a patient in this way. But utilizing prior documented CDC guidelines and precautionary measures in the office, we are very confident that we can, if needed, evaluate a patient safely.
Now, in terms of people that have some concerns, certainly Facebook or text, or first thing is to call, my friends.
Sam, let me just jump in there real quick. So just to piggyback on what Dr. Deom said, if we see these patients and we feel there is a concern and they meet some of the criteria, we can actually order a COVID-19 test. So, we work very closely with many healthcare providers in the area. We know many of them. And I was just on the phone earlier with a couple of them, and we can save these patients sometimes a trip to wherever by if we feel necessary, ordering one of these swabs. So, we have that ability to streamline things for our patients in the community. So I think that's an important point to make.
Terrific. Now, what's the cure rate here? Okay, so now, God forbid I have it, or it's something that's concerning to me. What would be the cure rate? What do they do? What do you prescribe? What happens?
Viral, unfortunately, has to run its course. But what we worry about with virus is secondary infection, and we want to make the patient comfortable. So depending on the case, and every case is individual, if we feel the patient is at risk for a secondary bacterial infection, we may prescribe something like an antibiotic or an antibiotic steroid combination. But remember that antibiotics do not make viruses better. They just don't. That's the big controversy. When someone's sick and it's usually something viral, you don't take an oral antibiotic for it. That's what changes resistance patterns of bacteria. So, we may prescribe something. We may do palliative therapy, such as artificial tears, cold compresses. In some cases, we might use a mild steroid to help calm things down a little bit. But sometimes we just have to let the virus run its course. So
education goes a long way, and I think talking to patients about what we can do to limit interaction with others or themselves in the office once we found out what is truly going on is part of really what we're doing right now. We have certain lid scrubs or cleansers that are actually on the approved list of I think there's more than 50 approved cleansers or things that'll actually kill the virus. So not to say that if you have it, this is going to kill it, like a spray that you would use on your face, but for patients that are maybe have a bacterial infection, need to put drops in, then you're touching your face a lot. So we're going to talk to you about different ways that you can safely put drops in. That might be using a special spray that helps decrease viral spread on the eye and on the face. So far and away, viruses are, when I talk to patients, I saw a couple emergency patients today, and I was talking to them about viruses. And for us, it's just normal place to talk about viruses. It's something we talk about probably 20 times a day. But when I say it now, I realize it carries a whole different meaning and magnitude of meaning. I think the important thing for patients to know is that viruses have been here longer probably than us. And they're going to be here for quite a long time also, and so we're going to make it through this and educating one another and helping one another is the goal that Dr. Kislan and myself have as members of this community now and forever. We want to be here to help the members of this community.
Some people maybe have a runny nose, and they don't have a cough or fever, and so should they panic? Will other people cough naturally, maybe whatever, mucus or whatever, and do we run to the doctor because we're coughing? Oh, now, if you have a fever, which of these three are really considered very important? I know they all are, but what's the most important one here?
I think fever is probably one of the most important things as far as we talk about COVID-19. The fever is the big thing. Jimmy?
Every day that goes by, the more we learn. So nobody's an expert on this, including myself and Dr. Kislan. We are all just trying our best to help the community and help the patients in our community. We are eye experts and eye health experts, and we happen to know that this does affect that. So we're trying our best to play our part and our role. I think the best thing is, if you're unsure and you'd like our opinion, especially as it relates to healthier eyes and vision, give us a call. If you're unsure about your health, sniffly nose, cough, even some reports of diarrhea, even some reports of, of course, fever, call your primary care doctor and see, if they're able to at least triage you over the phone. The most likely direction they're going to give you is stay home for 2 weeks. Why? Because the virus is dead after 2 weeks, which means it's no longer going to be viable in your system. The thing that the virus causes that's scary is of course pneumonia, which is an infection of your respiratory system and could cause serious respiratory failure. The virus itself, however, if it doesn't get to that point, will be dead after 2 weeks. So that's the recommendation, for folks who have symptoms to stay in because the virus itself is self-limiting. And that goes back to what we said about viral conjunctivitis that we deal with every day. There's really no treatment that we have for that, but we tell patients, we're going to support you and try and decrease the symptoms that you have. And that's by and large what, we're going to try and do for patients that are suspicious for COVID-19.
My friends, I'm talking to Doctors Kislan and Dr. Deom from the Hazleton Eye Care Specialists, experts in the field, also Stroudsburg Eye Care Specialists. The number's on the screen, folks. Call them if you have any concern. We're going to take a quick break. We'll be back right after this. Welcome back to the Sam Lesante Show, folks. These times we're trying to get you as much information as possible. I have Doctors Kislan and Deom on the phone from the Hazleton Eye Care Specialists and Stroudsburg Eye Care Specialists, talking about care of your eyes and the coronavirus, how that affects. Now, remember 247ssptv.com. This show will be seen a number of times, but also to YouTube Eye Care Specialists, Eye Care Today on SSPTV. Very quickly, Dr. Kislan, can people still wear their contact lenses?
Yeah, absolutely. We've been getting this question a lot. I think what you want to do, though, is make sure you use good hygiene again. Wash your hands before you put your contact lenses in. Wash your hands before you take your contact lenses out. And then wash your hands again before you pick up your glasses to put your glasses on. And you should also wipe off your glasses with, maybe some soap and water also. So daily disposable contact lenses from a hygiene standpoint are the best type of lens to be worn. We've been recommending those for years. If you wear something like a monthly lens, you still use your normal disinfection process that you usually do, but it's so important now more than ever because, as Dr. Deom said previously, this virus can be found in the eye because the eye is a mucous membrane. So you want to wash your hands before you put your lenses in, wash your hands before you take them out, and wash your hands then after you throw your lens away before you go to pick up your glasses.
Dr. Deom, I have a problem. Here's my problem. When I'm done taping today, I have to run to the grocery store, all right? And of course, people come up and you don't want to shake their hands, etc. But should I wear sunglasses to protect my eyes? What should I do when I'm walking in a grocery store?
It's a good question. I don't think there's any formal recommendations out there, so I don't want to, instill fear in folks. But I think, maintaining that social distance of, approximately 6 feet would keep you safe. If you have to be around people for a longer period of time on a regular basis, I think it's certainly within reason to wear, something in front of your face. But again, we just don't have good data to support this. As soon as there is data, we'd be happy to share it with folks. So no formal guidelines, but we do know it can be transmitted via droplets. Droplets can travel up to 6 feet, and it could be transmitted via the mucous membrane of the eye. So, for personal preference, if you want to wear glasses, that could help.
All right, my friends, remember they're available to you. The numbers are on the screen, 570-453-2020 and 570-421-3342. Dr. Kislan's in his office as we speak. Dr. Deom was in the office this morning. They're willing to take any phone calls, any concerns you have. Please call them. You're at home. They'll give you the directions. Don't wait too long. I want to thank you, Dr. Kislan and Dr. Deom, for doing this Facebook and providing this information to the public. I appreciate it very much. My friends, remember, they're on Everyday Eye Care today. Interesting show, believe me. They give a lot of great information. They're experts in their field, the latest in technology, second to none. We should be very happy to have these fine doctors in the area. There's another doctor working with you, right, Dr. Kislan? Who is that other person? I mean, you have other doctors.
Well, yeah, in Stroudsburg, Dr. Bellinger, she's actually in Stroudsburg, and Hazleton, and Dr. Olzinski's in Stroudsburg. So they're kind of covering our Stroudsburg office during this time right now.
Okay, thank you, doctors. Folks, remember 24/7 ssptv.com. My email, sam@ssptv.com. Thanks for joining us.